It's about this certain couple. They have gotten married in the past 2 years. They want to start having babies, but babies are not coming. Normally, they ran several tests, and all tests came out positive, like they are not sick. There's nothing wrong with them. The man is very okay. The woman is very okay. But they will try getting pregnant. Well, it happened that on this particular occasion, they came back again to the hospital for another test, maybe another result to come up, and they will find out if there's something wrong with the woman or the husband. But there was nothing wrong with them. So a nurse called the couple to her table and started questioning them. Madam, what do you do for a living? She said she's a stay-at-home wife. Have you been pregnant before? She said no, she hasn't been pregnant before. Okay, Oga, what about you? What do you do for a living? The husband is an oil company worker. He is okay as well, and he has made a woman pregnant before. So, the nurse asked the woman, do you know your ovulation period? Madam does not know her ovulation period. She and her hubby just have sex whenever he's at home, because he works this onshore and offshore kind of job. He's always like 3 weeks out, 3 weeks in, 1 week. So that's how his job, the nature of his job is. Did you know that the reason why this woman has not been getting pregnant after her ovulation period was calculated was simply because, you see, that 1 week that her husband is away, that is her ovulation window, and she cannot get pregnant. Nobody can get pregnant outside the OV window. Now, this is the story. Know your ovulation period so that you know what you're doing. This is it. The 1 week that her husband is away is her ovulation period, and the 3 weeks that he's around and they're trying to make babies, it did not work. So this is the reason you, some of you that will see this video right now, don't know your ovulation period. You don't know when you are ovulating. For people trying to conceive, your ovulation period is the time you should target. Okay? Even when you go to the hospital for checkups, maybe when you've tried and it's not working, sometimes or most of the time, the doctor will calculate your ovulation period for you and they will tell you, but it might change for people that have irregular cycle. So frequently, if you cannot calculate your ovulation period, frequently seek professional advice so that you will not be fighting what is not fighting you. This is my advice for you on this one. Knowing your ovulation period is very important for you as a woman. And this is one of the reasons a woman is not conceiving, because she's having sex outside her ovulation period. Number 2 reason why a woman is not conceiving, even when all medical reports says she is healthy and her husband is healthy, is the use of medications that are spermicidal or contraindicated for pregnancy. Self-medication is one of the problems under this particular reason. Taking medications or use of products that can impact fertility. When trying to conceive as a couple, when you are trying to conceive, there are some medications or some products, especially for our skincare enthusiasts, that you should avoid. That is why the advice of a professional is always a key. You should always solicit for the advice of a professional so that you will know what to use and what not to use at this stage in your life. For some products, it might be boldly written that this is contraindicated for pregnancy, but for some, they are not there. So do not self-medicate. And for people using so many skincare products always open up to your doctor so that he will know the one you should stop using or applying at that particular time where you're trying to conceive, in order not to disrupt your fertility or conception. Yes. And also, for people that have been using some contraceptives, there are some contraceptives that even when you have stopped them, they are like, or when you have removed them from your body, for the ones that are implanted, they are still active for like over 10 months or so. So you might be thinking that you're no longer on this particular medication or contraceptive, maybe you have gotten rid of it and now you're ready to have babies, but babies are not coming. It is because this thing is still in your blood. You just have to give it some time and you can have your baby. Because a woman's menstrual cycle is regulated by the interaction between the brain, the ovaries, and the uterus. So any health problem or medications that disrupts this interaction may adversely affect the woman's ovulation, which in turn prevents conception. This is why you have to be very, very careful about what you apply on your body, about the drugs you take, and about even your husband too, what he takes. And also, I will always resound it. Ensure to seek the advice of a medical professional to be able to know the ones you should use and the ones you should not use, in order not to prevent conception. So these are the two reasons that I have for you in this video. Not everything that the village people are doing. Sometimes it's your own fault, so you have to be very vigilant. Like I mentioned earlier, having sex outside your ovary window can prevent conception. In case you don't know your ovulation period, find out from someone who knows, from a nurse, a doctor, when next you visit the hospital. Also, intake of medications or use of products that are contraindicated for pregnancy can also prevent conception. Thank you so much for watching this video. If you enjoyed it, ensure to hit the like button, share to people, your friends and family, so that they will also be aware of these two reasons. Turn on your notification bell so that you will be notified whenever I upload new videos. Thank you so much, and I will see you in my next video. Bye.